Care Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show for Friday, October 19th. Hard to believe, ripping through October here. We're going to talk a lot about the heart today, but we're going to also ask the doctor on board with us about the electricity impulses in the heart. That is definitely something a few years ago I didn't know anything about. Once I got into healthcare PR, I learned a lot about the electrical impulses inside the heart. So without further ado, we have Dr. David Kenigsberg. He's a clinical cardiac electrophysiologist all over Broward County. He's at Florida Medical Center, which I know him from. He also has a few offices. I'm going to give out all the info during this interview, and also on staff at a few other Broward County hospitals as well. Dr. Kenigsberg, welcome to the program. How are you this evening?
Excellent. Thank you so much for having me. I'm really elated to be here.
And thanks for coming along. I always say to doctors on this adventure of health, because we always learn a lot on this show, and definitely, like I said, starting out, I didn't know that there was electrical impulses in the heart until a few years ago when I started doing research. Brought on a cardiac electrophysiologist, and I was like, what's going on here? And then I have heard other doctors explain as kind of an electrician of the heart. Is that correct?
That's correct. Well, I usually tell patients that there are plumbers for the heart. Those are the interventional cardiologists. They open up arteries. And there are electricians for the heart, and that's what I do. Deal with problems with electrical problems with the heart. The heart has an electrical system that's embedded in it, and it can go awry. Heart rates can either get too fast, that's called tachycardia, or too slow, called bradycardia. And we have different therapies and treatments for the different arrhythmias that occur. In addition, electrophysiologists take care of syncope, which means passing out, and try to figure out the cause of syncope in different patients. The majority of our patients come to us directly from cardiologists who are looking for us to do a more involved exploration as to the etiology or the cause of different problems, as I just mentioned, passing out, low heart rates, fast heart rates. And you're not off in the fact that this is a relatively, in medicine, a new field. Eindhoven first discovered the electrocardiogram back in 1903. In the 70s, electrophysiologists were just looking at big tracings of electrical signals from the heart. And then in the 90s, we got catheter ablation, where we were able to go in the heart and do diagnostic tests and procedures to burn. And in the past 10 years, electrophysiology has exploded with many, many new novel technologies that we'll talk about today.
That's great, and thank you for the history, because that's very helpful. And I know this is a kind of one of the more super specialties, I would call it, in my opinion. And it's great that you work with other cardiologists. They refer to you. That's a team-centered approach. We always talk about this on that program, and we're going to get into it. You work with heart surgeons as well. So cardiac electrophysiologist is not someone I wake up in the morning and call directly to their office and say, I think my heart's going too fast. It's normally through a referral process from a cardiologist or primary care physician.
That's correct, yes.
Okay. Good to know.
And then we are part of a team. So cardiologists refer, but we also talk to cardiac surgeons. We sometimes do procedures with cardiac surgeons that I'm sure we'll talk about as well.
Yeah, we're going to get into that. You mentioned something interesting, syncope, and I was, I'm sorry if I pronounced it wrong, but I was doing a little research on this. Is that fainting?
Yes, fainting or passing out, correct. And
Okay.
we deal with fainting, near fainting, or completely fainting or passing out, and there are different causes for it. So historically, there were people that were called fainters, people who at the sight of blood would pass out. That's in the spectrum of problems called neurocardiogenic syncope, which relates to how the nervous system, the involuntary nervous system, the vascular system, and the heart all interact within our body. And so someone who sees blood has an alteration in their heart rate and their blood pressure simultaneously, usually, and then they collapse and pass out. That's usually benign and self-limited. But sometimes people come to us and we don't know the cause of syncope. And in those situations, there are tests that we do. So one of the tests is called a tilt table test. Do a number of those a week. Just did one a little while before coming here. And that is a test of heart rate and blood pressure while a patient's standing nearly upright to see what happens over a course of time and sometimes with the administration of medications. And then if that test proves positive, then we have therapies. We can give things to clamp down on blood vessels called vasoconstrictors. We can give things to expand volume that are sort of like steroids, and other medications to lower the heart rate if the heart rate gets too fast. And then if we're perplexed, we sometimes put little chips or monitors under the skin. Those are called looping monitors. There are a number of different types of looping monitors, different branded looping monitors. And that takes about a minute to implant, literally. And those devices can record heart rhythms for up to 3 years.
Oh, fantastic. And we're here with Dr. David Kenigsberg. He's a clinical cardiac electrophysiologist and founder of the Florida Heart Rhythm Specialists, PLLC. Also, president-elect of the Broward County Medical Association. So congratulations on that.
Thank you.
That's great news.
Thank you.
So I want to ask you, is the tilt table test, is that under the umbrella of EP studies?
So electrophysiology studies really relates to an invasive electrical test of the heart. So no, it's dissimilar from that.
Okay.
It's distinct from that. In that situation, the patient lies on a table similar to a cardiac catheterization table, like a cath lab, and they lie on the gurney, the table that moves, and then we get access to the venous system or the arterial system and thread thin wires up into the heart. These wires have embedded in them electrodes, similar to what you would get from an EKG, but these are embedded in these thin wires. And we put them in different locations of the heart and do a diagnostic study to see how the normal conduction of the heart works. And then we also give adrenaline or isoproterenol and other medications to raise the heart rate or lower the heart rate and do testing in that setting. And based on the results of an electrophysiology study, which we call EP study for short, and we're electrophysiologists, we call ourselves EPs for short. Based on the results of the electrophysiology study, then we will decide what the patient could need after that. So they could need an ablation, they could need a device, they could need nothing. And that test is really helpful in ascertaining the next step.
Is someone out during the EP study, or are they awake?
So
There's a twilight even there.
Yeah, so nowadays the standard of care for most invasive procedures in the EP arena involve an anesthesiologist or CRNA to assist in usually MAC or general anesthesia. For just an EP study, they would be under MAC anesthesia, a twilight, as you say.
Okay, a twilight, okay. And then after that, you would take that study, take a look at it, and decide whether an ablation or other procedures needed, or maybe not even anything if that's the case after taking that EP study.
Correct. So, for instance, if someone came to me and they said, I had palpitations, the next step would be to do some kind of monitoring, either if it was captured on an EKG, which is approximately a 20-second picture, or a 24-hour monitor, which is a Holter monitor, or a 30-day monitor, which is for 30 days, or a loop recorder, which is another way of ascertaining what palpitations, what the cause of palpitations are, then based on that data, we would go ahead and do an EP study, and we would look for some type of arrhythmia. And based on the arrhythmia, then we would go ahead and do an ablation, a targeted procedure. The EP study uses deductive reasoning to try to figure out which rhythm we're dealing with once we get the patient into the arrhythmia. And the other trick is to make sure that the arrhythmia that we're inducing in the lab is really the clinical arrhythmia of the patient.
This is fascinating. This is a whole different specialized area of study in the heart and treatment for the heart. I'm really excited to have you on. It's Dr. David Kenigsberg with us, EP, cardiac electrophysiologist, Florida Heart Rhythm Specialist. Great website they have. It's flahrs.com. It's where I got all my questions. There's a ton of info there. You should be proud about that website because it is really well designed and
Thank
really
you very
nice.
much.
And it's for cardiac electrophysiologists with you in your practice.
We're a growing practice. We have currently 4 electrophysiologists. We also have 3 nurse practitioners and 1 physician assistant. We have 4 office locations and a very large staff to help take care of all of our patients.
Yep, they're in Fort Lauderdale Plantation, Lauderdale Lakes, Margate. Their number is 954-678-9531. We'll give that out a few more times in the program. We were talking about a cardiac ablation. So what exactly is a cardiac ablation?
So ablation in general terms means to treat or destroy tissue with energy. So in the traditional sense, ablation was done with radio frequency energy, called radio frequency ablation, or RFA. And that was historically the main way EPs took care of arrhythmias in the past. Nowadays, we have other energy sources. We have cryothermal energy, which is freezing. We also have laser energy, which we utilize. In the future, we'll likely have ultrasound as an energy source. So the process is evolving. But basically, for instance, let's say someone was 25 years old and they had palpitations, and they come to me and say, "Doc, I've had palpitations for the past 10 years that I can remember. Every time I'm sitting down or I get up or I'm doing an activity, boom, my heart goes from 0 to 60 in no time. I'm going at 200 beats per minute, and then I cough and it stops, or I bear down and it stops." So that's a typical history for supraventricular tachycardia. And the most common supraventricular tachycardia that we see is AV nodal reentry tachycardia. Probably about 85% of all the short circuit arrhythmias that we see are AV NRT. So I take that patient to the lab, I put them under a twilight, I do the EP study, I confirm with pacing maneuvers that this is the arrhythmia that we're looking for. Then I take out one of the diagnostic catheters, put in one of the ablation catheters. In this case, it'll be radio frequency energy by and large. I go into the heart area where I know it's coming from, which is called the slow pathway. I turn on the heat, turn on the energy, I zap that area, and usually that procedure's done well within an hour.
Wow. That's just amazing that's going on nowadays. Great heart care right here in South Florida. Dr. Kenigsberg, hold that thought. We're going to take a quick break, and on the other side, talk about some of the new ablation treatments available where Dr. Kenigsberg works with a cardiac surgeon on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Welcome back to the program. We're here with Dr. David Kenigsberg, EP, cardiac electrophysiologist in Broward County. There's 4 offices: Fort Lauderdale, Plantation, Lauderdale Lakes, and Margate. They are Florida Heart Rhythm Specialists, FLAHRS.com. And Dr. Kenigsberg, have you just mentioned which hospitals you're on staff at, starting with Florida Medical Center there in Fort Lauderdale, where I know you from?
Sure. We're on staff at Florida Medical Center, the 4 HCA hospitals in Broward County, all the Broward Health hospitals, Holy Cross Hospital, and we're starting to get on staff at the Memorial Hospitals.
You've got Broward County covered. That's great to hear. And I had heard about you throughout the years, so like I said, I'm really excited to have you on because I've known your name for a few years now, and it's because you work with a lot of other, great heart surgeons, cardiac surgeons. So if you would tell us a little bit of the options now available, where an EP, I believe, will come from the inside of the heart, and then the heart surgeon will come from the outside, and you guys kind of meet in your thought or your treatment there.
Sure. So there's a lot of procedures that surgeons do by themselves and that electrophysiologists do by ourselves. However, at times we need to work together, and I love doing that. I've identified some surgeons that I really enjoy working with, especially at Florida Medical Center. I got to give a shout out to my friend, Dr. Eric Byer, who I really love working with. And what we do together varies, but for instance, if someone has had a pacemaker or a defibrillator for many, many years, and there's an infection, that's a foreign body, I need to take it out. I'm very adept at putting it in. It's very easy to put in a device nowadays. We have very good tools to do that. But to take it out, once it's healed and scarred in, it requires a laser. We call that laser lead extraction. Or it could also include a device that kind of cuts through the scar tissue as well. Regardless of the tool, we need to work together with a surgeon, the EP and the surgeon together, to extract or remove that from the body. So that initially was how electrophysiologists and cardiac surgeons started working together. But it's evolved into a lot of the complex ablations that we do. So there are patients that have very refractory arrhythmias, most commonly atrial fibrillation. Now, historically, Jimmy Cox started doing AFib ablation in the 80s, where he would do what's called a cut and sew maze. He would take the heart, basically, and make incisions in the heart to create a rat's maze in the heart so the electrical signals couldn't propagate through, and atrial fibrillation would be cured at a pretty high rate, as well as stroke risk reduction as well. Surgeons nowadays do a modification of that surgery with different energy sources called the Cox Maze 4 procedure. But as electrophysiologists, we are trying at times for very severe forms of atrial fibrillation, persistent, meaning they're in it all the time, or permanent, meaning it's very refractory to any therapy, to approximate what the surgeons do. But at some point, we started working together with procedures where the electrophysiologist will do endocardial or ablation inside the heart, and cardiac surgeons will do ablation outside the heart, and we'll try to cook that steak through and through. Mm-hmm. So if you think of your heart tissue as a steak, you want to get the lesion to be transmural all the way through the steak. And so if the surgeon can do things on the outside and we can do things on the inside, we can cause or result in transmurality. And that's why we work together. So Dr. Beyer and I have been working together since he came to town years ago and have had great success in different hybrid type procedures. One of those procedures involves making a small incision in the chest as well as going through the groin. Sometimes we stage the procedures. He does his part, I do my part at a later date. There's a procedure that you mentioned called the convergent procedure, where we go in from below and get to the back of the heart and take a device that has suction cups and kind of ablate the whole posterior wall of the heart in sequential order. We've done very rare and challenging ventricular arrhythmia ablations together in an area of the heart that's really hard to get to, called the left ventricular summit. So there's lots of things that surgeons and EPs that like each other and are like-minded and think well on their feet can do together. And luckily, I've identified Eric to be able to work with.
That's great. Thanks for the explanation. And I will say, yeah, that's for when you're working with a cardiac surgeon, it's for more severe cases. You're doing a lot of cases on your own where, an ablation where a cardiac surgeon may not be needed. So that's a good thing to point out.
99% of what I do is by myself.
Okay, those severe cases, you bring in a team, more of a team-centered approach. But you're already working with a team with EPs anyways. But, yeah, that's great explanation. And everyone should realize, I mean, the heart, I've been told, is about the size of your fist. We're talking like a very small area that all this is going on. So kudos to you and your team.
So I wanted to point out, when we talk about ablation, for instance, the ablation catheters are 3.5 to 4 millimeters in diameter. It's a very small area. So a common question that I get is, Doc, I really don't, I'm worried about you burning in my heart. Are you going to damage my heart? Well, first of all, this is geared essentially at damaging abnormal electrical tissue. We don't want to mess with anything that is normally working or conducting. And secondly, it's a small area. 3.5 millimeters is a small area. So there's really nothing to worry about.
Okay, yeah. And I actually have some family members have had the ablation, and they've told me it beats getting the paddles in the the cardiologist's office. Once that's treated, it really takes a lot, I guess the way to say it, off your chest. You're back to quality of life. You don't have that bird fluttering in your chest or whatever your symptoms may be or may not be, because sometimes it's non-symptomatic, right? AFib.
Correct. So atrial fibrillation is a very interesting arrhythmia in the sense that I have patients that can't get out of bed in the morning because of their AFib. But I have other patients that their heart's going 150 beats per minute and they're playing tennis.
They're used to it, yeah.
So it really varies as far as what patients' symptoms are. And it's my job to kind of elicit, do they really have symptoms? Sometimes the symptoms are subtle. People could come in and say, Doc, I used to run 3 miles, but now it can only run 2. That may be a symptom of atrial fibrillation.
Mm-hmm. Is this something that kind of, we have the baby boomer population is the fastest growing population, or the biggest, I should say, not fastest growing, but the largest population sector of this country. Are you seeing it more in that age, or can it develop in like a middle-aged adult or younger? Where do you see it mostly?
So what I love about my field, electrophysiology, is that I deal with patients from 18 to 110.
Wow.
The age range is so wide that I get to interact with lots of different patients. Supraventricular tachycardias usually occur in the younger people. And AFib becomes more and more common as we get older. So we see a lot of different patient types and ages, but the AFib is more a disease of age.
Okay. We're here with Dr. David Kenigsberg. He is cardiac electrophysiologist, or EP for short, founder of Florida Heart Rhythm Specialists in Broward County. It's FLAHRS.com. Their number's 954-678-9531. Go to the website. They have offices in Plantation, Fort Lauderdale Lakes, Margate. I know we broadcast that way as well. And you can always find this show on allcountyhealthcare.com if you ever want to go back and look something up, or on their Facebook page as well. Doctor, we got about 2 minutes, and I wanted to ask you, I got two quick questions. Transesophageal echo. I knew I was going to not. I'll let you say it.
Transesophageal echo. So,
did we cover that? I don't think.
no, I'll mention it. It's a diagnostic test where we stick a tube down the esophagus to take a look at the heart from the back of the heart, and that allows us to see an area called the left atrial appendage, and make sure there are no clots in the heart. The other thing that's interesting about that and the left atrial appendage is now we have devices that can close off that appendage, because about 90 to 95% of clots that come from the heart in atrial fibrillation that cause a stroke come from that little appendage off the left atrium.
That little area causes a lot of the problems.
A lot of problems. So when we talk about blood thinners and anticoagulants, and now we have this device, the Watchman device, we have the ability to help patients mitigate or reduce their stroke risk, either with medications or, if they can't tolerate medications, a procedure.
And that Watchman catches blood clots before they go to the brain?
Correct. It doesn't allow them to escape the appendage. It kind of seals it off, and then the body is supposed to grow over it or endothelialize, cover over it.
Fascinating. You guys are doing the Watchman as well at Florida Heart Rhythm Specialists.
Yes, we're doing it at Florida Medical Center. We just started doing them there, and we've been doing them in Broward County. We have the largest experience in the county, probably in the Tri-County area, with the Watchman device.
Nice. Well, thank you so much for sharing all this info. This was great.
My pleasure. I'm really happy to be here.
And check out Dr. Kenigsberg. It's FLAHRS.com. Thank you, and have a good evening. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.